know you can sing.
Yeah.
There she is.
We're waiting.
You're still in the back.
We're waiting.
Oh, no, it's not happening. Sorry, maybe another
She's
day.
great.
Is she?
She is.
If the doctor's saying it has to be true. We're not starting a press conference, you start singing.
No. I'm not putting that pressure on.
It's the first time in 9 years I'm following the strip, making sure I don't get off key here. So thank you everyone for coming here. I said this is going to be the new norm, unfortunately, yesterday as we announced the first 2 corona cases of 19 in Albany County. As we have figured was going to happen, and the other people that were testing came back positive. So we have 2 new cases since yesterday, so a total of 4 total cases. I want to commend Dr. Whalen and her staff because the one person is a middle school student, so we have to track it down. On top of what the doctor's been doing, her and her staff around the clock and working hard, it's not easy because you think of yourselves in the media, the people that you intertwine with every day, day in and day out. So we're doing that. And I will say to the people that are watching this and listening to it, please don't panic, stay calm. The health department will reach out to you if you're one of them that we feel you are exposed. Also remember, it's still the flu season, so people are walking around with coughs and sniffles and everything else. Just keep that in mind. Don't think that you have the coronavirus. But unfortunately, we have to be prepared. It's probably going to grow in numbers because of the contact, but we're on top of it. I commend the governor and his staff. We've been talking to them around the clock more now than our conference calls with the situation going on. We're addressing it. We're addressing a variety of issues, as everyone's aware of. We closed our nursing homes to visitors yesterday. I'm suspending all congregant mail sites for seniors in Albany County for the next 30 days and adult daycare for seniors for the next 30 days. We have an aging population in our community. We have over 60,000 seniors over the age of 60 that are vulnerable to this. So I say to everyone out there respectfully that are over the age of 60, or if you have any respiratory or heart problems or a bad immune system, use caution. Use caution. Please don't go out in public. Just be careful and keep the 6 feet distance from people. But most importantly, wash your hands, cough in your arm, and just use precaution and try not to touch your face and nose or whatever, your eyes, which is kind of difficult at times when you think about it. That's why I'm burying my hands underneath me so I don't touch my face. This is something that we're prepared for. As you know, Sheriff Apple opened up his EOC in Clarksville. We also opened up our offices there, just preliminary, because we got to be ready. And we've been having conference calls with everyone, the town leaders around the county, talking to them. And we have been talking to the school superintendents and to verify what we think, and they have to make the decision. AAU, as you know, canceled its season for the next 3 weeks, all AAU stuff inside the county. So these are things that's going to be the norm, and I say to parents, get ready. If they do end up closing some schools, try to find some alternative means or, to address that issue. That's where we're at. I'm going to try to keep it as brief as I can moving forward because I know your time's valuable, and as we continue to get updates, and trust me, I'm not going to drag you down here every hour. We're going to try to keep it to one a day as this continues to grow and go in different directions. We will let the people know, and we're staying on top of this. I don't know, Liza, if you want to add anything? Or
I would just add the 2 cases that we have diagnosed in the past 24 hours were direct contacts of one of the cases that we identified yesterday. We worked with the Wadsworth Lab and Albany Medical Center to make sure that the testing could be expedited for these individuals. Both individuals are doing well at home. Neither have been hospitalized. And this is part of the investigation that we are doing with our 2 index cases. As we continue the investigation, we develop what are called concentric circles. And with those concentric circles, we sometimes identify people that have minor symptoms that may not have presented to their healthcare provider, but because of the concerns around the communicability of COVID-19, we do recommend testing. This was the situation with both these cases, and we are happy that we were able to make these diagnoses in a short period of time. With these cases, we will be doing additional contact tracing, and we can expect additional testing. So the likelihood is that there will be more tests done and more cases that could be found in the near future. And with every case that is diagnosed comes decisions. So this morning, we did, in keeping with the state recommendation, ask that Farnsworth Middle School be closed. The superintendent took a precautionary decision to close the district. We will be working with the superintendent and with other community partners to ensure that we have safety within the community, and expect that we'll have more decisions like this to make in the coming days and weeks.
Also, there's a lot of reports that store shelves are being cleaned out of products, like cleaners and paper products. We're noticing that. I think you've seen that yourselves firsthand. You know, look, I understand everyone has the impulse to go stockpile everything, but what I'm asking the viewers is leave stuff on the shelf for people that don't have it. Take what you need, but you know, you don't need to stockpile it at this time. So that's just another thing we're trying to address as we move forward. But that's it for now. I don't know if anyone has any questions.
Are both cases in Joe Berlin?
No.
Yes.
Well, yes. Yeah, the new ones, yes.
The 2 additional ones?
Correct.
And so one was a middle school student at Farnsworth?
That's correct.
Correct.
Dan, have you had any discussions with Albany Net? We noticed that there's a tent.
Yeah, we have been, but Dr. Wellen can talk more of that, but we are in constant communication with all the hospitals, but Dr. Wellen?
Sure. So Albany Medical Center, we've been working very closely with Albany Medical Center, and I understand that we have developed a partnership with them that they, I believe, are going to announce and give more information about today at a press conference.
There's also more of a wondering, somebody was wondering about this, and I couldn't answer it, maybe you could. If somebody does get the coronavirus and they come through it on the other side, are they now immune to getting it?
Yes.
They
Yeah.
have antibodies and they're good. Okay.
Correct.
Well, Doctor, could you talk a little bit about the statistical spike on why people in charge are doing this as far as the quarantine and closing stuff down? Can you talk a little bit about that? You know what I'm talking about. Can you speak on that a little bit?
I'm not sure what
On a
you're...
safe zone, like trying to stop the spread, is that what you're talking about?
Yeah, and so everybody's not going to the hospital at the same
Correct. I mean, listen, the ERs can't handle everyone running there, and that's why we're just having these press conferences and telling people to go to first stops. Actually, even if you go to your doctor's office, they're not even really letting you in until you fill out a checklist, and they're trying to go through a list of things to try to prevent the spread, and that's what we're trying to do.
What I can say is that yesterday we did send a blast fax to all Albany County providers to help them identify a process to work with patients that are calling their offices that are concerned that they may require testing, desire testing, have symptoms. So as of yesterday, we provided all of our local docs with a form they could utilize to order the test if they feel that this is appropriate. We are working with Albany Medical Center on that. We will get the information on who is tested, and the local health departments will be responsible for that tracking as the testing is going on.
What does it say to you about the, I guess, contagiousness of the virus that, you know, 2 people who came in contact with one of the original patients in the county came down with it so quickly?
So we know that this is a communicable disease that has a pretty high rate of infectivity. The number that's used to determine how many people usually get COVID-19 after being exposed is called the R0, and that number is estimated at 2.2. So for every case that's positive, if that case is not contained, the likelihood is that they could expose 2 additional people. So it's not surprising that household contacts would be affected.
So just to clarify, those 2 new individuals are in the same household as the person they got it from?
That's correct.
And that is the Gilder, the 30-year-old Gilder woman?
Correct.
The woman in her 30s, yes.
Yes, in her 30s.
Can you say anything about where the 30-year-old worked? I don't know if that came out, but we were...
No, not at this point in time. We're addressing and tracking and mapping it, and again, you know, it's about keeping everybody calm. The health department will reach out to anyone that they're in contact with. We are addressing that issue. At this point in time, we cannot.
Union College had said they had a case, but those numbers didn't add up as far as an additional case. So that's, I think, what we were...
It's not an affiliation with Union
No.
College.
Thank you.
Yes, sir.
Can you clarify a little bit what you suspended in terms of those senior activities?
The congregate meal sites, so where we have seniors meet and we feed them, so we're addressing that issue. We're identifying the seniors. It's about senior isolation too, to get them out once a day. So we're identifying the ones that need to be fed versus the ones that are just there for the, you know, that are meeting people. As we identify that, that's why we're doing it on Monday, to make sure that they get their food every week, every day. And the same thing with adult senior daycare, because they are a vulnerable population. We don't want them congregating right now. So we're erring on the side of caution more than anything else. We're trying to be proactive here.
Can you quantify the effects that this is having with all the cancellations in Albany?
You know, someone asked me that question yesterday. It is going to have an economic impact. It's going to have a big impact on our budget next year, but I can't worry about that. What I'm worried about is the safety and health of our residents first and foremost, and not so worried about the dollars amount. I know some restaurants are voluntarily closing right now. You know, again, that's their call, and we're going to address this as it continues to go in whatever direction it continues to go in.
Dr. Weller, this is sort of backtracking, but can you go into detail about why masks are not recommended or effective?
So masks are recommended for those who have symptoms to contain their symptoms. As you know, we are working very closely with our providers on information related to their supply of masks. There are no masks recommended to be worn by the general public because it's not a protective measure. This infection is spread by droplets, and if a person is individual, it's appropriate that they are masked. In conditions, these household contacts likely became infected because the original case we weren't aware of soon enough to quarantine the individual that was sick. If we use these distancing measures within the home for cases that are identified, the likelihood is significantly decreased that their household members will become infected. But it's a matter of finding cases early, and that's why we need to increase the testing.
So does that mean that the standard person who has not necessarily had someone in their home or been in direct contact is not protecting themselves at all, or does that mean that the priority should be the people who really need the masks have them?
So let me just be clear, we don't recommend people that are in a home with someone that's quarantined be wearing masks. It is just that they are spaced away from the person. You know, everyone's best method of protection is to keep their hands clean. That is really the important driver of infection, is contact with the surface and contact with respiratory secretions. If we keep our distance and someone is coughing 6 feet away from us, the risk is mitigated. If we are washing our hands when we're touching high-touch surfaces, the risk is mitigated. Those are the strategies that we would really implore the general public to be very cognizant of in their movements every day.
Doctor, I know it's still early in all this, but do you have any statistics that these mass social distancing and cancellations are working yet for that kind of, with the spread of the virus?
So what we know about mitigation strategies is that they blunt the curve. And I think this is something that I discussed yesterday, and I think the curve that I'm referencing has been shown again and again in the media. if we do not utilize strategies related to community mitigation, like closures, like social distancing, like utilizing hand hygiene, we can expect a very quick peak of infection with a lot of members of the community infected at the same time. The concerns around that, of course, are overwhelming hospital and other healthcare systems. We really want to ensure that those systems can continue to operate, and to do that, these mitigation strategies blunt the curve so we have less people infected overall, which is a good thing, and that the timeline is a little bit longer so we can continue to have the supports that we need to address this in the community.
Do you expect more cases before it falls?
So I would not be surprised. And this, I would say, is not just necessarily because of the cases that we found, but as is happening across the state, the testing availability is widely expanding. There are 28 labs that are expected to go up into operation across the state on Monday. And as we have more labs, the availability of more testing, and more test sites hopefully opening up, we will likely see many more tests, and the likelihood is, out of all of those tests, there will be more positives.
Have there been more tests done related to the Albany case at this point? Like, are we waiting on those results?
Yes.
Yeah. No, we are. And as I said, we're mapping and tracking everything, so it's going to change. It's going to change every hour. As we're getting information back, we will address the media, and we're continuing to chase down everyone. So it is correct. It is going to go into the other direction. Last question, because I have to get her back to Department of Health for obvious reasons, and we have to continue on. Yes?
Sure. Two things. One, is there an updated total on the number of people either under mandatory or voluntary detention in the county? And two, can you confirm that one of the new patients works in the medical field?
Is it,
So updated numbers as of 5 o'clock yesterday, I believe there were 17 mandatory quarantine and 17 voluntary quarantine, and we expect those numbers to go up significantly.
Is that individuals or households?
No, that's individuals. It's not households. But it is going to change, obviously, because of the contact these people had with.
And that's the governor said that old healthcare workers should contact their previous employers because there's a shortage of healthcare workers to try to mitigate these disasters, if some workers get sick, etc. Is that happening at all?
We have a medical corps. It's been in place for a very, very long time. They're up and running. We put a thing out, too. We're looking for more volunteers. Yeah, it's going to change. You got to think about the fire departments and police that respond to calls, and this happens. They're going to be put on the sidelines. So it is something that's addressed. It's nothing new. We're looking at how they're handling it in New Rochelle and Westchester, and we're looking at how other parts of the state handle it, and across the country how they handled it, and across this, this great world of ours. So it is an issue that is addressed, and will be continued to address. So we're ready. We'll have A, B, and C team. But I do have to end the conference right now because we do have to get back.
But my other question, does one of the new patients work in the medical field?
We're unable to discuss anything at this point in time.
Thank you, everyone.